Okay, so now we're going to move on to our webinar. So I'm really excited to introduce the webinar. At the end of 2022, NAFEA commissioned a project to examine the costs of placements for universities in education and health. And I think this is a topic that people have been trying to grapple with for a very long time, to quantify exactly how much universities are paying for students, particularly in education and health, which have historically attracted fees for placement. And I think with the University Accord now coming out and the focus in the Accord, I think this is really quite a timely piece of research. The project received $10,000 in funding, as well as providing in-kind contributions from various members and institutions. So the co-leads were Dr. Anne McLeod, one of the co-leaders, and Elise Bailey, Anne from CSU, Charles Sturt University, and Elise from Griffith. We also have Sarah Dahl from the University of Queensland, Dr. Judith Needham from Griffith University, Sharon Crawford from Federation University, and I'm also on the project as well. So I'm going to hand over, I'm going to stop sharing, and I'm going to hand over now to Anne and Elise to provide an overview of the project. So over to you, Anne.
I'm going to hopefully this is going to work sharing properly, because I'm only on one screen. So here's hoping it's going to work. I'm going to share this here and let's see what happens. Share that there. Okay. And go, sorry, you can see yourselves. Yeah, make that a bit bigger. Okay, so I can't see anybody, so I'm just going to keep going and butt in when you need to butt in at this point in time. Or please put any questions in the chat, and when I'm not talking, Elise will be talking, and vice versa. So please do that. Look, before we do begin, I do want to make acknowledgement on the Indigenous lands that we're all meeting on, as Ricky has already done, but to understand the fact that the support and the learning that we can have from our Indigenous partners as we walk together on their land is something that I think we need to acknowledge now, and acknowledge for in the future, and for our future elders and future students that we have. So our question was, what are the costs of work integrated learning for key stakeholders? And that's universities, industry professional partners, WIL students in education and health disciplines. That was our original question. And then we thought, no, that's too big. And we brought it right down and brought it just in the fact of what are the costs of work integrated learning for key stakeholders in education and health disciplines. And we're looking at basically our universities. Because when we started looking at professionals and partners and students, I mean, that's part 2 and part 3 of our research, folks. That's what it is. So Ricky's already basically said this, so I'm going to actually hand over to Elise to continue with this. And Elise, just give me a ding or a dong to tell me when to go on to the next page.
Thank you, Anne, and I'm sorry my internet dropped out just at the end there, so please let me know if you can't hear me. But yeah, thank you, Ricky, for that introduction, and I did hear that you've obviously just quickly gone through our project team roles and responsibilities with Dr. Anne McLeod, myself co-leading this research, but also yourself, Ricky, from QUT, Sarah Dahl from University of Queensland, Judith Needham from Griffith University, Sharon Crawford from Federation University, Ben Archer from Charles Sturt University, and Tessa Knight from Griffith University. So the project team do come from across 3 states of Australia, and this research is to be nationwide. So I think that it is really important to have that representation across numerous states, because we know that when we talk about costs, that can be completely different in different states. So it's good to have the voices as we built this project to make sure that we're not missing anything. Look,
next page.
Next, slide. Thank you, Anne.
It's always good when the next slide doesn't happen.
That's okay.
Okay.
Well, look,
There we go.
There we go. Perfect. So look, before I jump into the purpose and scope, and I know it's been just roughly discussed or mentioned, I think that it's important to acknowledge the fact that the timing of this research is on point given the recent Universities Accord. There is some very specific areas in there that discuss around improving the quality of tertiary data and metrics. The fact that there is not great quality data, we do not understand, which means that then we can't quantify our issues. So to be able to provide some of this information and data is really timely to start to open up this as a discussion point. Now, look, the purpose of this project is to identify the enablers, barriers, and impacts of higher education providers in paying for work integrated learning activities. As it mentions on the slide here, that is across education and health in Australia. Education being, I think makes quite a lot of sense. Health is quite broad. So to give some more context to that, we would be talking across all of our allied health, our nursing, midwifery, also into social work. We are looking at the health lens being quite broad because we know that there are workforce shortages in all of these areas. And I think that it's important to acknowledge all of these and make sure we capture information on all of these areas. The scope of the project is to include the investigating of the costs. So that would be financial and in kind, as Ricky mentioned, for education providers, so for our universities. As professionals and educators in this space, we understand our own areas, our own costs. However, bringing that together and understanding when we have complex rules and complex ways of paying for work integrated learning does make this very important, but also quite a minefield of how to capture that information to represent it well. It is important to note that this is when we did start to discuss the research and what information we would capture, we did, like Anne said, we had to really look and be quite definite in what we were going to look at, what we were not going to include, because it was blowing a little bit out of proportion of what we could manage and what we could do in one hit. So what we are not going to be looking at in this initial project is the cost and the impact of fees for industry partners, for our students, for the patients, the children, the clients, those that are utilising the services, and also to our school students and our school teachers. Not to say that that's not vitally important, that we do understand and recognise those costs. However, it's just too much for one research project. This also does not include the quality or the impact on the WIL experiences, because that is another body of work that would be best done separately. Next slide, Anne.
Okay. So, am I going to talk about? I can't see your face, Elise. It's really odd.
Thanks, Anne. I'll hand it over to you.
So, I want to talk a little bit about our project design and where we're up to. So, our project design is around some data collection using Qualtrics and then using interviews. So, I'm going to talk a little bit about our survey. I'm not going to give you the full show of the survey, but it's going to be very important that you as members and those people that might be listening to this afterwards is to encourage your education and health disciplines at your university to complete this survey when it comes out to them within the next 2 or 3 weeks. So it's going to be very important that we as a crew of NAFEAites, I like that idea, of NAFEAites, that we can actually go forward and actually make this this survey really utilised across the nation. So with our data analysis, what we're actually going to be looking at is we're going to be looking at these surveys-based outcomes, and we're going to be looking through that with our working party. The other part of it is, in part of the survey, is that we will be actually asking for some interviews for people to just spend 10 to 15 minutes just working through some of the nuances that they have at their university. Ricky, would you like to talk a little bit about our literature that we've talked about thus far, or are you happy for me to continue?
I'm happy to do a brief overview. So
Thank
the
you.
project has undertaken a systematic review of the literature in this space. We used a program called Covidence to upload all of the identified publications, which there was over 2,200 publications identified through our database searches. We then went through a systematic review of those publications and excluding publications that didn't meet the criteria for our project. It resulted in 16 extracted publications for full review, and they're currently being reviewed at the moment. And I believe some have been excluded from the full review as being not relevant to the project. So currently there really is very limited research around the cost of will to university is the bottom line. And
so we obviously have a space there for us to actually go forward and actually drill down into. So it's quite an exciting space. And it has taken some time for us to get there because we spent a lot of time, that's probably a good 6 to 9 months, actually facilitating down to this question of what are the costs of work integrated learning for education providers in education and health disciplines. The amount of time and discussion we then had about the survey was another almost probably 6 to 9 months, because we had to figure out what the survey is going to meet nationally. So we're looking at education and health disciplines individually. We're going to be identifying placement costs and whether there is a benefit. So we had to drill down on what does placement cost actually mean? And so that's the total expenses incurred by the higher education providers in order to deliver the work integrated programs. And that encompasses not only the placement fee, which is often the case, but also other such expenses as, you know, the providers for resources, perhaps additional wages for the delivery of will, and identifying whether or not the placements are completed in the public or private sector, because that actually also is another way in which costing can be measured. If there are in-kind costs, for instance, if you're in health or social work in the department, rather than if you're in a private enterprise, you're paying a lot more. Further questions around that survey is identifying those types of placement costs there. I know that there's a lot of words on this particular slide, but this is why I've put it there, because this is going to be going out to our wonderful people. Because we want to talk about what the payment types do denote, and also the categories of those when we talk about public and private industries and non-government organisations. So what we're actually asking the survey is the survey will be actually completed per discipline. So whilst the survey in its time might take only about 5 or 6 minutes to do, it's supposed to be 5 minutes per discipline that we're looking at. So it is what it is. We thought to ourselves, no, do we send it to one person? Do we send it to all? We believe that this is the best way for us to actually disseminate this information or to get the information back. The other thing is that we need to be looking at the average costing. And so we've provided some average costings across those 5 areas there, or five payment slots. And we are then asking for some actual written responses rather than just figures, to give us a little bit more guts around the qualitative work here. So we're looking at identifying the challenges education providers face, requesting improvement to placement costing models. Is there some way that somewhere, maybe in Tasmania or up in the Northern Territory, that they've got a brilliant costing model for placements? Let us know about it, because I'm sure everybody here and listening to this webinar remotely, you might have an idea, and that idea might help a lot of people. We want to know about it. And then finally, we're going to be talking about the impacts to the education provider due to the cost. Now, we know, as Elise already brought forward, and also Ricky, about the Australian Accord that has come out in the last couple of weeks. We know that the expectation that placements in the health and education field are going to be paid. Where and how are we going to find that funding? We don't know, but I think that, you know, we need to be not have rose-colored glasses on where that money might come from. But this survey here itself might find a way in which, you know, what other impacts might there be for us in this front? So I'm actually going to stop sharing just at this point in time. Just stop sharing that, and hopefully everyone's going to come back to me. Yes, great. I can see everybody again. And we were thinking of doing a breakout, but we've only got a beautiful niche number of people here. But we want to open up to some conversations, and this is going to be recorded, and that will help us for anecdotal evidence. We're just waiting on our final bits for our ethics to come through, so we won't be taking exact comments from this forum. So I need to let you know that. So we're not taking those exact comments, but we can make anecdotal comments based on what people might be thinking about in your own areas. Are there some barriers or enablers that you have in your actual in your workplace at your university that you know, you'd like to bring forward today? And would really appreciate if you don't feel comfortable in talking out loud because it's going to be videoed, please please write something. And I've only got one screen.
There's
I know
Q&A in the chat as well, Anne. So I can put
there's
questions
Q&A in the chat as well.
In the chat, yeah.
Oh, I've got two screens here. I can only see one. So I'm happy for people to either put their hand up with the emoji or just to yell out and say where you're from. And that would be great to have some discussion around this. I'm jumping to the other screen.
Are there any questions around the scope of the project or anything related to the project as well?
I know it's a Friday, folks.
So the intention of the next steps of the project really are to disseminate the survey that Anne has just been referring to. And as Anne mentioned, the survey is looking per discipline at the different costs and how the costs are split across public and private, getting some qualitative data from you around some of the enablers and barriers of work with graded learning and payment for placement. We're hoping once the ethics approval comes through that we'll be able to disseminate the survey hopefully next week. So we'll be circulating it to all of the NAFEA members and asking them if they could please fill out the survey, and that data will then form a crucial part of the project. Then post survey, we'll be looking for some people to have some interviews with, so we can get a little bit more of the qualitative data around, particularly the enablers and barriers, I think, of graded learning in education and in health. And we could do.
Okay, so I've just seen a question around the actual. Could you provide an overview on the types of questions in the survey? So that was when I went through the actual Chris Edwards. I don't know whether Christopher. I don't know whether or not you heard me going through the actual different types of questions about the survey, because that's exactly what.
Sorry, Anna, I was in transit probably when you were talking about that.
Okay, no, not a problem.
Yeah, I was in
so basically, so there's two blocks of questions that we're looking at. The first block of questions is looking at about and a yes, no answer sort of things, looking at every survey that will be completed needs to be completed on a specific discipline. So if you've got health, there's going to be a different one for social work, midwifery,
nursing,
podiatry,
sorry,
yes, nursing. Thank you, nursing.
Going, yeah.
Oh, easy, yes. I mean, how many do I know? And then what they're going to be looking at is, you know, do you pay for placements? Some people don't, some people do. So for social work, we know that at the moment, some in New South Wales, placements aren't paid for. We also then look at the selected discipline. You know, what sort of percentage are we looking at that go to public or to private? And then looking at also sort of the average costing that we're looking at per student per day. And we're classifying a day as 8 hours. That took us time to figure out too, trust me. And then we're looking at, for the public placements and, you know, and private placements, what are some additional costing that there might be? And looking at the different type of costing that we might need for private You know, just looking at those, that ranging of costing, and even if there's a cost for cancellation. So there was about the costing, and then the block 2 questions are talking about the challenges that you might face and listing any suggestions of improvement, and then, you know, what impacts on the education provider because of the costs, and then any other comments, and whether or not you'd be like to come in or like us to contact you for an interview. So that's basically the rough structure of the survey. I hope that helps, Christopher.
Christopher has said thank you for that, Anne, in the chat.
Good, excellent. Oh, cool. Okay.
Perfect. Thank you, Anne. Yep.
Yeah, not a problem. Thanks. Kylie, I can see you've got your hand up.
Hi. I'll try and video for a second. There's a face to the name.
There you go. Good morning or good afternoon, depending where you are.
4 minutes away from good afternoon.
Okay.
So this sounds really great. I'd be more than happy to, you know, share this internally at University of Melbourne for you. Is there going to be a specific focus on domestic, international, or are we going to look at it as a whole? Because I know that there's additional challenges for international students when it comes to their experiences.
That's a really good question. At the moment, we're talking about students that are enrolled at the university. So we haven't actually drilled down to the international or non. So some placements actually do go international. So obviously there are additional costs for that, but not the international students themselves. And that would come into, in our discussions, we talked about, do we think about what the students' experience is in WIL? And that's part 2, shall we say, of the actual project, because there's part 2 about the students, because we know about placement poverty. It is real, and a couple of articles even yesterday that were out in the paper and on the ABC about placement poverty yesterday, and we know that's a really important field that we need to hone into. And I really think that the international students going on placement is another whole.
It's a whole other demon. Yeah.
It's a good point that you make, though, Kylie. Sorry, Elise, I was just going to make the point that there are sometimes, and I'm aware that in health, there are sometimes differences in charges for international students compared to domestic students.
Oh, yeah, that's why.
So some organisations will charge more for an international student to go on placement than a domestic student. So we haven't explicitly asked for the breakdown of what you pay for domestic students or international students. But I think if that is happening in your space, it'd be really good to get that kind of that story in the comments on the survey, to talk around any kinds of differences between your cohorts of domestic or international.
Even Kylie,
there might be other differences.
Even Kylie, perhaps if you would like to take on board doing an interview with us, and we could do that conversation, that'd be great. That'd be awesome, in fact. So please, when you get the
manager's in the room, actually, so maybe we can
no, that'd be great. That'd be a great thing. Judith, I can see your hand up. It's great to see you, Judith. Well, sort of see you. We can see you.
There you go.
Hi,
I'll put my camera on. Hey. I just love the idea of displacement poverty. I'm going to just tell you a little story about what's happened to us in the last 4 weeks. We popped in a EOI for our second-year students, 4-week placement to do part-time placements. We gave 800 students the opportunity to EOI for that, so they could go and do work. We had 12 students EOI for 48 placements that I'd created. So we've now converted my 48 placements back to 4-week placements where they'll do their 160 hours in 4 weeks. And then from that 12 that we actually had EOIs from, 2 have actually pulled out of the program, out of the course.
Isn't that interesting, Judith?
So
I think hang on to those stats for us.
Will do.
That's going to be.
We had a similar story as well, Judith. We were hearing from students that they wanted part-time, they having trouble committing to full-time, and made the point that some students are enrolled part-time but have to do full-time placement. So I went about and developed a part-time placement opportunity with one of our industry partners, and we ended up in the same situation. We didn't get enough people to fill the part-time placements, and we had to end up moving a lot of them back to full-time. So yeah, it's a challenge. They're obviously experiencing placement poverty, but they don't want to do it part-time either, by the sounds of it.
True. Good questions. I can just see Karen's got a hand up. Karen Carrington. Karen, whereabouts are you from?
I'm from Griffith University in the School of Nursing
She's
and
with
Midwifery
me.
with Judith.
Oh, good.
So I thought it'd be also interesting to point out on the back of Judith's comment about the part-time offering that we had. We also have done for the past 2 years a split placement for our 2803 group of students, which is that second year group in trimester 1. And that has always been a really popular option for students. So the part-time or the split placement option that we provide is 2 full weeks. They have a break of either 2 or 4 weeks, and then they go back and do their 2 weeks. And that has always been something that's been quite popular for the students. So it's surprising when students had the opportunity between part-time, doing either 2 days 1 week, 3 days the next week over 8 weeks, or having the opportunity to do 2 weeks, have a break, then go back and do another 2 weeks. That was the more highly sought after option for students. So it's interesting to see what the dynamics there are. So I just thought I'd pass that information on as well.
Thank you so much. Look, I'm actually having to head off. Double booked here. Ricky, can I pass this on to you and to Elise? Elise,
Yeah.
I've got you tracking this one. Thank you so much for the
Thanks, Dan.
opportunity. And I look forward to speaking to you, Ricky, in the not too distant future.
Indeed, and congratulations on your election.
Thank you. And thank you everybody for the meeting. And I look forward to supporting what we can do and go to the future for NAFEA.
Thanks, Anne. And look,
Bye.
I guess talking about placement poverty, that is another side of this lens. And obviously you can see how much work goes into just a different structure of placement to support students, which then potentially doesn't even work for students. And I guess the costing behind that for that structure is different. That costing would be different to our universities. This cost debacle that we go through, that each university will, or each unit of the university, allows us. And I know from my space, I'm in allied health, which also covers exercise and sport and social work. Just the different costing arrangements across that space is so vastly different from our industry bodies that support unpaid placement, and that is just it is what's expected in the industry, so that we are bringing through the future workforce all the way through to our hospital and health placements, which are paid with cancellation fees and the like. So it is. And when we need to or would like to push something forward, as in a new initiative, it all comes back to the cost. Everything does sort of boil back down to, well, how much does it cost? Okay, well, can we move away from this because it costs? It's almost like work integrated learning is not something that we are pushing forward. It is more like, how do we move away from that cost that is associated, and not then looking at, okay, is this something that is really it is beneficial, it is integrating our students through, we should be having more of it, or looking at how we can work better with our industry partners. It's more like a bit of a battle as to, well, we can't pay that, so what are you going to do for us? And so these partnerships become so valuable and so important. So yeah, I guess that sorry,
it kind of seems like a symptom of our current climate within the university world. I think budgets have been an issue. I mean, even pre-pandemic there were issues, but obviously the pandemic just accelerated all those issues, and now it feels like universities' senior executives in universities, their main role at the moment is to just manage budgets and nothing else, and to cut budgets. And when you're cutting budgets and reducing resources, that becomes really difficult to support programs like work integrated learning, because work integrated learning, for it to be really quite effective, there's quite a lot of work that needs to go into setting up the programs, scaffolding the programs, and monitoring it and evaluating it. And it's this constant, cycle. It's not something that starts and ends. It's a continual cycle. So yeah, I kind of feel like that concentration on budgets and finances and cutting the costs of work integrated learning is sort of a fallout of the university sector at the moment. Judith, you got your hand up.
Yeah, sorry. But we've been basically told we need to consider how we spend our budget as far as sessional staff for our supervisory roles. Our sessional budgets are being cut considerably by the university, and we're being told that use placements that are invoicing, because that money comes out of a different pool to what our actual school budget is offered. So we're trying to work out how we sit, and our head of school is looking at everything with a fine-tooth comb.
I
Thanks,
think everyone
Judith.
is.
Yeah, and I guess I'd be really interested, because through this project we will be trying to get some really strong information on the actual dollar costs, but the in-kind costs is something that can be so varied across different universities
And hidden and very
and
hidden.
hidden. Yeah, is there anyone that does have something that they might feel is a bit outside of the box, or just what those in-kind costs are like for you in your space?
I might jump in there that when we have special programs that might be for cohorts of students to go to different regions or in rural and remote, that oftentimes you'll need someone to go and visit or give a bit of extra support. And I think that in those circumstances, that's often not factored in to the funding, and it can be a large amount of extra work, important work, but not necessarily seen as being part of what's being funded by that program.
And often not in workload models either, those site visits to follow up and monitor student progress. Just getting onto the cost of placements through the project, we've started to unravel some information around what some of the disciplines and across the different states. And it's interesting to see that education is pretty stable across each of the states and consistently being charged across all of the states about the same amount. When we start to get into, and medicine is similar as well, they seem to be quite standard across the country as well. But within health, there's such variation. Victoria seems to be the only state that is stipulating costs for placement. Other jurisdictions seem to be either not charging, or it's just on a one-to-one relationship. So it's a commercial agreement between the university and the particular state or facility within that jurisdiction, which doesn't lead to very transparent costings across the sector. So I think that's one of the issues that I find in health, is it's not very transparent what is being charged. And I'm hoping that our project will be able to sort of give us some insight into what that looks like in that space.
And Ricky, on that point, I guess where we accept students that can, coming from across the nation to study our programs, but yet we do need to find them placements in health in other states where we are not typically in Queensland in that program paying for placement, but yet we're needing to pay to place that student in another state. And like Ondine mentioned, having to have a supervisor either fly there or employ somebody from there to help to supervise that student. They're all issues that then come back to something that is outside of our control in the will space, but yet the cost is absolutely, it's something we almost have to fight for in our space, to allow that student a good student experience and to stay where they are rather than, you know, moving around. So it's, you know, it really does open a lot of issues where we have differences across the states, across, in the same area or discipline in health.
And then the costs to support, you know, certain equity groups as well, which is obviously a huge component of the university's accord, is around increasing participation and access to education for certain equity groups. And we know with certain equity groups that there's a little bit more support and scaffolding that you need to be able to provide to them, and that often comes in the form of staff time and resources to be able to support those students to be in parity with the other cohorts that are in university. So I think with the university's accord, that's going to put more pressure, well, and rightly so, put more pressure on universities to ensure that the populations of universities are reflective of the wider community. But that's going to come with requirements of additional resources. So yeah, it's going to increase costs even more if we're going to have same kind of quality of student experience.
Yeah. It's very interesting around the international students and the increasing cost for international students, and what disciplines that actually, or what areas that is actually impacting. In some, it might just mean that placing international students is just extremely difficult, whether there's a cost associated or not. But where the cost does mean an increase, you know, what does that look like from our administrative perspective as those students are coming through? Being an international student, does that actually mean that there is more work for that organization? Is that fair? How do we, you know, how do we look at that as well from, you know, from each institution? Really interesting to have this work be across the universities and across the states, to actually get that benchmark of where we're at in different areas, so that we can lean on that data and that information to hopefully go to our different bodies. You know, I think of you know, social work as opposed to exercise and sport, and I think of nursing, midwifery as opposed to some of those, and how those differences are just so vast. That what does that industry body actually want to see? What do they want their professionals and the support of their professionals coming through this, the university, to look like? And does the cost affect the outcomes? And do they then have a part to play in setting some standard, or, you know, supporting in some way? You know, I guess looking from what could be the outcomes here? What could we utilize this research to affect moving forward?
Elise.
Yeah, Matthew.
Oh, sorry, Rick. I didn't mean to
No,
cut
you
you
go
off.
ahead, Matthew.
But just a quick question. This is such a great project. It's fascinating listening to it. So thank you. There's so many things going ahead. Just a quick question. Does it also, you're talking about the front ending and the looking and the, you know, how talking about the hidden workload and how long it might take, say, international students to place as opposed to a domestic student. That's really, you know, it'd be great when that comes out, because what people say, you know, the time frames and the value placed on relationships building, and whether that's accounted in workloads, as Ricky said. But are you also looking at like those increased potential supports that are required for students, maybe international versus domestic, not just the placement and the setting up at the start, but also what other investment time might be needed to help students be successful whilst they're actually on the placement?
So we are asking for the in-kind costs. So those costs that are, you know, the non-financial as well as the financial costs. Obviously thinking about the fact that as in a survey situation, it's hard to, and across this many areas, it's hard to ask the specific questions. So we are asking some more broad, comments as well on areas that are impacting you specifically in each discipline. So it does give you the opportunity to answer this survey across one discipline. We found that trying to muddy that with too many meant that you couldn't get some accurate data because they are so vastly different. So yes, we are asking for that information as well, because what we can capture here, like you said, and from what Ricky has mentioned in what research is actually currently available, there is not a lot of research around this. It's an area that is very confusing. It's not standard. When we look at it from one state or one discipline, we look at it internally in our own university, it's so different. A lot of people are, I believe, just in my position, some people just don't want to know about it. It's almost a bit scary, like, oh, and if I ask the question, does that mean the cost will go up? If I don't ask the question, so it's also really difficult. And that's some of the challenges we see as people almost, oh, I'm on a good thing. I think maybe, do I want to say something? Is that going to ruin that? Is that, but then that's left us in this position of really having not a lot of understanding. It's a lot of conversations that we have with our colleagues, but it's not actually documented anywhere. We don't have that really solid evidence of what is happening. And as the Accord mentions, without that solid data and solid evidence, where do we go? How do we then influence the future of what this looks like? So it really does open opportunities, I think, Matthew. But yeah, absolutely. And really good point. Thank you.
That's great. Thank you.
And I wonder whether payment, I guess this is something that will come out of the project, is, what benefits do we get for paying for placement? I've spent a lot of my time in the will space in the nursing space. I obviously also look after allied health, but my time tends to be more in the nursing space. And I've had people who are not in nursing and not paying for placement say to me, oh, we should just pay for placement because we'll get such better quality placements if we do that. And my response has always been, well, not from my experience in nursing, like you don't get any better quality because you're paying for it. And you don't actually have any relationship power to influence things when you're paying, even though you're technically a customer. So I'd be interested to hear if anyone does see any benefits from paying for placement, whether that does provide you with some leverage to negotiate with your industry partners or not. And I know Judith has probably got an opinion on this.
Oh, a really good opinion. I'm taking leave this afternoon, Ricky, for a couple of weeks. I'm happy. No, seriously, I don't believe that there is a big difference in paying for placement or not paying for placement in relation to the benefits that we get from it. We do, though, and we're very lucky here with Griffith, we do get the opportunity to sit on interviews for their supervisors. And I know, Ricky, that Sandra has been also involved in interviewing for some of the supervisors that provide that to our nursing students. The concern that I have in some instances is that we may pay for things, but we are told that they're their employees and that they will deal with any backlash. So we don't have a lot of say in that respect. If it's my own clinical facilitators and I only have 2 hospitals that I provide supervisors to these days, I can look at the data that we receive through NPEC, which is great data in relation to what the students think of clinical supervisors. And then I'll go back to the health organisation and say, so how are my supervisors going? They're the only ones that I can actually provide a lot of information to for follow-up. Whereas, some of the other organisations, and you'd find the same thing, you don't get to performance review anybody.
No, it's quite difficult.
And what is the education that these people are expected to have to supervise our students? That's probably one of the key things. Have they an understanding of what our curriculums are? Do they understand what the expectations are from the universities? We've had a couple of students just recently, they've attended placement, but not in the correct uniform. And who's actually picking them up?
Judith, I have a question on this topic. With the, given that you're paying for placements, do placements just get cancelled last minute from the hospital
Oh,
or
we have
from the
that
provider,
occasionally.
even though
Yep,
you're
and
paying?
yeah. So,
Okay.
and Karen would be backing me up all the way here. Occasionally they will
100%.
shuffle things around. They'll say, oh, well, no, the students can't go here now. They've got to go to this ward. And we're like, no, they need to stay where you first allocated them, because that's where the students have been expecting to go. And that's where we've been prepping them for. We get charged if we cancel a placement less than so many weeks out, but they don't get charged by us for doing that. And we've then got to shuffle students around. So that is a major issue with us, with some organisations.
At
And
least to give you a bit of context, it happens regularly. Like,
that's being nice.
And it's usually the Friday before the placement starts on Monday. And it's usually at 3 o'clock in the afternoon when they're just about to walk out the door, and then we have to deal with it. So it is really, really difficult. And then the students blame us. So it makes it even harder.
Yeah, thank you for that, Judith and Karen. I think my thoughts along that lines were in some of those disciplines where we really are scattered across all sectors. We're not paying for placements, but that the fallout from our organizations last minute can be quite, it can happen quite regularly. I must admit that's becoming less and less now. I think we're focusing more on our partnerships, but it is an issue. And I wondered whether if you are paying, you are almost guaranteed. It's not just going to be a complete fallout where you do have to go and source a completely new placement.
Yeah,
so
well,
it's
sometimes we
almost a
do
shift,
have to source.
Yeah,
sometimes we do. And as Karen said, it can be last minute on a Friday, and I could get a phone call from Karen and say, this has happened. And I'm like, oh, Jesus. And we try really hard sometimes to just swap students around where we can, but it's not always easy. The other thing that I'm finding is we're paying for placements, but we need to provide a bit more education for people. So expectations, how to do assessments, various different things. So I've been running workshops, and I'm pretty good at these workshops at the moment, quite regularly across Metro South, Metro North, spending 1 to 2 hours with their supervisors that we're paying for to actually upskill. So that's my time. That's part of my, and it's not classed in my workload. That's just part of my service role. So while I'm teaching, I'm being taken, and doing that, I'm being taken away from my teaching role and my other components within my workloads. I'm still not quite sure how that actually all fits in.
Thanks, Judith.
Yeah, it's really a challenge for everybody.
And I guess when you're talking about supervisors and upskilling supervisors, or PD for supervisors, which do then allow for them to meet the requirements of that placement that you're requiring in the system to mark them, but also the quality is what you're looking for as well, is to improve that quality while we're not doing smaller workshops like that, like you're doing. We are running 1 to 2 annual workshops across all of allied health, and you're doing that too, which
we run a big one, and then so we run a big one for industry partners and our own clinical supervisors, and then those supervisors that can't attend, I've just had 14 at one of the placements that I went to, and another 16 at another place where and then Karen was very kind with one of our clinical placement coordinators and ran one for Gold Coast Primary Health Network for me, because I couldn't make it that particular night. So they went through expectations and stuff. And then I got charged, or they tried to charge me for us going down and actually doing the supervisory workshop. They wanted to charge us for the food. And I'm like, seriously? we're providing you with a service.
Mm. And I think if we look as well internally at our structures that are managing this, our placement officers and our staff that are educating, and the cost that that is to the university, depending on the different structure as well, that is a significant cost to our universities, is our administrative and our academic staff that are involved in making sure that work integrated learning goes ahead and is successful. So, you know, that's something as well that we are looking to gather some information and
Elise,
feedback on.
I think the other thing with that is there's a lot of different systems out there that we're all that everybody's using, and how does it all integrate? So obviously, Griffith uses Sonia. Then you've got In Place in Victoria that is being used. There is many different aspects of how we all run our business. And is it something that we could look at making it a bit more consistent? We're not going to be able to change Sonia and In Place by any means, but, you know, just our processes. And I know that our team in the nursing midwifery side of things for Griffith have certainly improved processes between Queensland Health and ourselves through having team sites and things like that.
And it does, yes, it absolutely. From this, we could look at some different opportunities as we work better together. This is a great forum, NAFEA, to have the combined staff actually look at some solutions then based on this information.
So Alicia, probably only got another couple of minutes before we wrap up. So I don't know if there's any particular questions anyone had that's come out of any of the discussion that we've had. But the next steps will be to disseminate the survey to NAFEA members, and as Elise and Anne covered off, it's one completing the survey for every discipline. So then we get data per discipline to be able to compare that across the board. So it would be great to have people's involvement and volunteering to be interviewed as part of the project as well, so we can get that qualitative data. Elise, anything else you wanted to add?
No, look, that's it, Ricky. I do thank you all for sticking around and attending this webinar. It is, you know, I guess it's an area that we're quite passionate about. It's an area that obviously affects a lot of us in certain ways and to different varying degrees. So we are really looking forward to and hope that you can assist us in disseminating this survey when it does come around, because that will then allow us more robust discussions with better research data and information. So yeah, really appreciate it, and really appreciate your support, Ricky, and NAFEA as well. No.
It's a really important topic. We will also be communicating to councils of deans in different disciplines so that they're aware of this project, and hoping that they might be able to support it and encourage their members to complete it. So, and I think at least we're also contacting sort of main sort of deans as well within different areas. Again, just to alert them to this project and hopefully get some buy-in from those universities.
Yeah, and Ricky, I guess as well on that point, if you do receive the survey, if there is someone that you feel we should be getting in contact with from your university, please do feel free to reach out. You know, we would love that support, because as we're aware, you know, different reporting lines, it is sometimes nice. You might think of somebody that is really important within your space that you think we could provide some more information so that they're aware. Yeah, thank you, Ricky. That's all from me, and I really appreciate it again.
No problem. That concludes our AGM and webinar. So I'd just really like to thank everyone for their participation and attending today. Also want to say thank you to the Executive Management Committee, who no longer will be in the committee, and to welcome the new members. We'll be in contact very soon. So thank you very much, everyone. Enjoy your Friday and enjoy your weekend, and hopefully we'll see you at another NAFEA event very soon. So take care. Cheers, everyone.